Imagine waking up with a tingling sensation on your lips only to find a fluid-filled blister forming. Yes, we're talking about cold sores. These pesky little blisters, also known as oral herpes, are more common than you might think. They're caused by something called the herpes simplex virus, which tends to take up residence in our bodies and cause these outbreaks from time to time. Cold sores are typically found on the lips and around the mouth, and while they may not be the most pleasant thing to look at or experience, they're not particularly dangerous. However, they are highly contagious, which means you can easily transmit the virus to others through close contact. Now, here's a fact that might surprise you. It's estimated that approximately 2/3 of the world's population under the age of 50 are carriers of the herpes simplex virus. That's a significant number, showing just how widespread this virus really is. Approximately 67% of the world's population under the age of 50 has the herpes simplex virus, so you're certainly not alone if you've ever experienced a cold sore. Cold sores aren't just an overnight thing, they have a life cycle that typically lasts up to 10 days. Now, let's explore the journey of a cold sore from the first inkling of its existence to its eventual departure. Imagine a day like any other when suddenly you feel a slight tingling sensation on your lip. This is the first sign that a cold sore is about to make an appearance. This stage, known as the prodrome stage, lasts about 1 to 2 days. It's like the cold sore's way of knocking on the door before it enters, uninvited. Next comes the blister stage, where small fluid-filled blisters burst onto the scene. They usually cluster together, creating a larger sore. This stage is when the cold sore is at its most visible and painful, and it's also when it's most contagious. So remember to avoid close contact and sharing personal items like lip balm or towels. As we move into the third stage, the blisters burst and a shallow ulcer or open sore forms. It might look a bit gruesome, but it's all part of the process. This is also a painful stage, as the open sore can cause discomfort and make eating or talking a bit tricky. Following this, the sore starts to dry out and a crust forms over the ulcer. This is the crusting stage. It can be itchy and may even crack and bleed. It's a sign that the healing process is well underway, but remember, the cold sore is still contagious at this point. Finally, we reach the healing stage. The crust falls off, leaving behind slightly reddened skin. The cold sore is no longer contagious, and there's a sense of relief as life returns to normal. Remember, the healing process can take up to 2 weeks, and popping or picking at a cold sore can prolong this and increase the risk of infection. So it's best to let nature take its course and allow the cold sore to run its full life cycle. While there's no cure for the herpes simplex virus, there are ways to manage cold sore symptoms and reduce their severity and frequency. So let's talk about treating cold sores. Over-the-counter remedies are often the first port of call when a cold sore strikes. Creams, ointments and patches are readily available and can speed up the healing process. These treatments generally contain an antiviral ingredient that works to suppress the virus, helping to alleviate the symptoms of a cold sore and shorten its lifespan. But what if over-the-counter treatments just aren't cutting it? Well, that's where prescription antiviral drugs come in. These medications are potent fighters against the herpes simplex virus. They can not only reduce the symptoms of a cold sore, but also prevent the replication of the virus. This means that while they can't cure the virus, they can help to control its activity, potentially reducing the frequency of cold sore outbreaks. Now, it's crucial to remember that while over-the-counter treatments and prescription medications can be effective, they are not a substitute for professional medical advice. Consulting a healthcare provider is an essential step in managing cold sores. They can offer support, provide appropriate medication, and give advice tailored to your unique circumstances. Remember, each person's experience with cold sores is different. What works well for one person may not work as well for another. This is why it's so important to talk to a healthcare provider. They can help you find the most effective treatment strategy based on your individual needs and situation. In the end, the goal of treating cold sores is not just about reducing discomfort or improving appearance, it's about enhancing your overall quality of life. Cold sores can be a source of stress and discomfort, but with the right treatment and self-care strategies, their impact can be minimized. With the right treatment and self-care, it's possible to minimize the impact of cold sores and maintain a good quality of life. In addition to conventional treatments, there are also complementary or alternative medicine treatments and home remedies that may provide relief. Let's delve into some of these alternative approaches. Over-the-counter creams, ointments and patches are often employed to speed up the healing process. They aim to alleviate the discomfort and reduce the severity of the outbreak, making life a little more bearable during the healing period. In the realm of alternative treatments, some people turn to complementary medicine. These could include methods such as aromatherapy, acupuncture, or herbal treatments. However, it's essential to remember that more research is needed to confirm their effectiveness. While they may offer relief from symptoms, they do not directly combat the herpes simplex virus that causes cold sores. Moving on to home remedies, these are primarily used to manage the pain and discomfort that come with cold sores. You might find solace in a cold compress or a DIY lip balm with ingredients like coconut oil, which is known for its soothing properties. Another popular remedy is a warm tea bag applied directly to the sore. The warmth can ease the discomfort, while the tea's natural tannins may have antiviral properties. However, it's crucial to understand that these home remedies, while they can alleviate discomfort, do not cure the underlying viral infection. They can make the healing process more bearable, but they do not shorten the life cycle of the virus. In the end, it's always wise to consult a healthcare provider when dealing with cold sores. They can provide professional advice and prescribe antiviral medications if needed. These medications can help reduce the severity and frequency of outbreaks, and unlike home remedies, they directly target the virus responsible for the sores. While these treatments can offer relief, they should not replace medical advice and treatment. Now that we've covered the what, why, and how of cold sores, let's tackle some common questions. A common query that pops up is, how can I prevent cold sores? The answer to this lies in understanding the triggers such as stress, fatigue, extreme weather conditions, and even hormonal changes. By managing these factors, you can reduce the frequency of outbreaks. It's also crucial to maintain a robust immune system with a balanced diet, regular exercise, and adequate sleep. Next up, are cold sores a sign of a weak immune system? Cold sores in themselves are not a sign of a weak immune system. However, frequent or severe outbreaks may indicate an underlying issue with your immune response. It's essential to consult a healthcare provider in such situations. Another interesting question is, can cold sores spread to other parts of the body? Yes, they can. The herpes simplex virus, which causes cold sores, can spread to other parts of the body, such as the fingers or eyes. This is why it's important to avoid touching a cold sore and then touching another part of your body. A question often asked is, do home remedies really work? While home remedies can help manage symptoms and provide temporary relief, they do not cure the underlying viral infection. It is always recommended to seek medical advice for effective treatment options. Lastly, can cold sores be completely cured? Unfortunately, once the herpes simplex virus enters your body, it stays there for life. However, this doesn't mean you'll have continuous cold sores. With proper treatment and self-care, you can manage outbreaks and minimize their impact on your life. Remember, it's always best to consult a healthcare provider if you're dealing with severe outbreaks or frequent cold sores. Don't let cold sores control your life. Knowledge is power.